Hello, little Tank. You're a big tank, aren't you, hey? All right. Yeah, good boy. All right. Do you want to come over? We'll get Tank's weight for today. Good boy. Stay there. 20 exactly. So we'll just go through some questions for Tank today. So when did Tank eat last?
Last night.
Yeah. And he's been well, no vomiting, coughing, diarrhea.
No.
Now, we've just got to check a few things on him. He's got no umbilical hernias on his belly. No, not that we can feel there. No hind dew claws that are bugging you. Hello. Yes. No hind dew claws. Good stuff. And is Tank microchip?
Yes.
Yeah,
yep.
Good stuff. So we don't need to do that today. So we'll mark him desexed on his microchip as well. So if he's not registered, you can then register him after today. Now we do offer pre-anaesthetic blood testing with all of our anaesthetics. Basically what that does, it checks his kidneys, his liver, his blood cell count, make sure all of his organs are pretty much processing the way they're supposed to at the moment. And if there's any abnormalities or changes, we can change the anaesthetic to suit him or put him on fluids. If everything's normal, that's fantastic. We know his levels in the future if he gets sick at all. So now that is an extra cost of $119, but we do leave that up to you what you'd like to do. Perfect, this is a good idea. And part of New South Wales Council have also asked us to put a tattoo in every animal's left ear when we desex them. We do leave that up to you. If you'd like that tattoo in his ear, it is a personal choice. Awesome. And during anaesthesia, sometimes their blood pressure can change and it can drop. If that does happen, we do like to put them onto intravenous fluids. If that's the case, there will be extra charging at the end, but you're fine with that. So we'll give you a call when Tank's in recovery and arrange a discharge time this afternoon. Okay? Good boy.
Hi, my name's Kate. I'm a vet here at Companion Animal Vets, and this is Tank, our little patient today. He's a 5-month-old Staffy Cross, and he's in to get castrated. So 5 to 6 months is when we recommend to do a desexing. They're generally quite a low anaesthetic risk, and I think desexing is a really excellent thing to do. It prevents a lot of health issues for male dogs, including prostate issues as they get older, and obviously removes the issue of testicular cancer. And then it can also help a lot with behaviour in terms of calming them down. So today we're just going to do a quick health check on Tank, make sure he's nice and healthy, heart and lungs are all good, because we are going to put him under an anaesthetic today, and we want to make sure he's absolutely spick and span healthy. So once we've done that, we'll take a blood test and just check and make sure all his organs are functioning well. And after that, we can go ahead if everything's all good. So to start with, I have a good feel of him. All his lymph nodes feel okay today. I've had a little check of him. All right. All right, do you mind just holding him still?
Good boy. I know.
Okay, so I want to check his teeth and see whether he's got any baby teeth left. So he's good, he's got all his adult teeth now. He's also got nice pink gums, and his mucous membranes are really moist. Skin tent's normal, so he's well hydrated today. Okay, so I listen to his heart.
Good boy. Good Tank.
So I can't hear any murmurs or arrhythmias in his heart, which is fantastic news. It's a normal rate. He's breathing nice and evenly. He doesn't have any increased respiratory effort or noise. So all of that's looking really, really good. Now, importantly, I want to check and make sure he has got both his testicles present. Yep, so they're both there, which is great. Doesn't have any hernias. So if he had hernias, that would be something we could repair at the time of desexing. And he doesn't have any hind dew claws. So he's looking really, really good. Now for the fun part.
Good boy.
All right, we'll just make sure he doesn't have a fever. Good boy, Tank. I'm sorry, mate.
I know.
Beautiful. So he's got a normal temperature. So he's checked out really, really well today.
Take it off.
So we'll be right to get his blood test, make sure that's all looking good as well, and I'll draw up some anaesthetic drugs for him, starting with his pre-med, which will just make him nice and sleepy and calm, and it'll help make the anaesthetic a lot smoother, and then we'll go ahead with the procedure. It's really important to check whether they've got both testicles. If they've got a retained testicle inside their body, that is at really high risk of developing cancer. So we need to take that out straight away if they've got one present in their body once they reach a good age for desexing. So we're just going to take some blood from Tank now. We like to try doing this before we give him his sedation, just so that we can get the most information before we do it. But if he's too wriggly, we can give him a very mild one just to make it a bit easier and make it a bit less stressful for him. So we'll give it a try now, and then we'll go ahead with the rest. So I'm just going to shave the arm once we get him to sit still. Good boy. So this just gives me a better view of the vein and lets it be an easier blood draw. Good boy. Okay. So then I'm going to take a little alcohol swab and clean the arm. Good boy. Just make sure it's all nice and sterile. You are so okay. Okay. Such a good boy. So we'll see if he's alright with this.
Good boy. Such a good boy. Such a good boy.
Okay. Good boy, Tank. So, oh, down. There you go. So Becky's just occluding the vein now, just to make sure that little spot doesn't bleed anymore. We just hold that off for just a few minutes. And then this is the blood that we're going to use to do his pre-anaesthetic blood test. And after this, we'll give him his pre-medication once we've checked his blood results.
I know, you're so
Okay, beautiful.
good. You were a trooper.
Yes, he did so well.
You were there.
Yay! All right, so he gets to go back in his cage for a little while. We'll check his blood results. I'll get all his drugs ready, and then we'll move on to pre-medicating him. All right, so we've just finished with Tank's pre-anaesthetic blood test. We found a few mild elevations. We've just got a mild elevation of one of his liver enzymes and a mild elevation of one of his white blood cells. So this is why we do the pre-anaesthetic blood test. It lets us pick up anything that's going on in their body and lets us manage it the best we can to make a safe anaesthetic. So I've been on the phone to his owner, we've talked about it, made sure absolutely everything's okay at home. He seems to be healthy at home. He's not having any clinical signs of illness here. So we're going to go ahead with the procedure with just some intravenous fluids. And now he's ready for his pre-med, which is just a light sedation that'll make the anaesthetic a lot smoother, make him nice and calm for the anaesthetic induction, and also provide a lot of pain relief throughout the procedure. So we're about to give Tank his pre-medication. That's his light sedation before the procedure. So we're going to give this intramuscularly, which is going to sting a little bit, but it's a lot more reliable in its absorption and it absorbs a lot faster. So we'll be doing that now. It'll take about 10 to 15 minutes to take effect, and then after that we'll go ahead and induce him and start the procedure. Okay. Good boy. Good boy. There we go. Good boy. Okay. All right, so that's all done. We'll pop him back in his cage and we'll come back to him in about 10 minutes or so. All right, so Tank's pre-med's kicked in. He's nice and sleepy now, really relaxed for us to put the catheter in his arm. So the catheter is just a little needle that goes into the arm. It's a little plastic needle that allows us access to his vein. That's where we'll be putting in the anaesthetic solution to make him fall asleep for the procedure. After that, we will intubate him. So we put an endotracheal tube in, which just goes into his trachea through his mouth. That lets him breathe throughout the procedure, keeping his airways open. It also lets us put oxygen and anaesthetic gas into him throughout the procedure to keep him asleep. After that, we can prep the surgery site and then we'll go into surgery and complete the castration. So I'm going to try using the spot I clipped earlier for his blood draw. Just use a bit of alcohol to clean it off again. Okay. Okay.
Boy.
So catheter's in. I'm just gonna flush it, make sure it's running okay. Beautiful. So that's all in and working.
Good.
So now we're ready to give the anaesthetic solution. All right, Becky's ready with the tube. All right, so we'll give this. Good boy. Okay. Beautiful. Boy. Thanks. Might need a slightly smaller tube actually. Go for an 8. So I'm just popping the tube in. There we go. So we can connect him up to oxygen now. There we go. So that's now a flow of oxygen just into his lungs. And we can turn on the isoflurane, which is our anaesthetic gas. It's a nice depth at the moment. No, not much. It was quite a tight fit, so we'll just do a tiny little bit. All right, Becky's going to get the pulse oximeter on now, which is just our little monitoring device to check his oxygenation and heart rate while we're doing the procedure. We do further anaesthetic monitoring equipment while we're in surgery, but out here while we're prepping, we just use the pulse ox. All right. Good boy. Yep. Onto his back?
Yeah.
Okay. Beautiful. Excellent.
We need some rhythmic working.
Yeah. All right. Are you right holding him? So I'm just drawing up some local anaesthetic that we place into the testicles before the procedure. So this provides an extra layer of pain relief for him, and it's just makes the anaesthetic a little bit smoother so he doesn't feel it when we do the castration. During the procedure, right now he's completely anaesthetized, so he's not aware of his surroundings at all. He's fast asleep basically. He's got pain relief on board, but his body can still feel things happening, he's just not conscious of it. So that's why we do the local anaesthetic, so it doesn't change his heart rate and respiration rate, just to keep the anaesthetic going nice and smoothly. All right, so local anaesthetic's just here. Heart's still going good, still nice and pink. Eyes are in the right position. So throughout the procedure, we continuously monitor them, make sure everything's going okay with heart rate, respiration rate. We want to make sure his gums are nice and pink, he's breathing okay. At the moment, everything's really smooth for him. So Becky's just putting in the local anaesthetic now into his testicles and just the incision site, which will be right here. So that takes about 5 minutes to take effect and completely numb the area for him. And we should be ready to go into surgery soon.
Alright, so we'll just do time out before we start. So this is Tank. He's getting castrated today. You don't need any special equipment.
Nope.
Or no imaging needs to be done. Special steps for this patient is on intravenous fluids. Surgery site is all prepped and ready to go. Sterility needs to be confirmed in the kit.
So cat was sterile, yep.
Okay. And we're doing an ear tattoo after he is desexed. Okay.
Great. So I'm just placing a sterile drape over the area. Actually, Becky, do you mind quickly lowering my side of the table a little bit?
The V.
Right, so at the moment, I'm putting the surgical drape down. This is a sterile field, all the blue. So that's gonna remain sterile. And these are my little towel clamps to hold it in place. So at the moment, he's fully anaesthetized. He can't feel anything, or he's not conscious of any of the feelings that are happening to his body. We've got local in the site, and his anesthetic is nice and stable. So, are you ready for me to go ahead, Becky?
Yep.
All right. All right, so we make an incision through the skin. And we want to get down to the layer of the testicle. So we try and pop it out. And then to that, we just avulse the ligament a little bit just to get a bit of better exteriorization of the testicle. Make an incision through the capsule, enough to pop that out. Okay. So now I'm going to clamp off the vessels. So this is the blood supply to the testicle. I put a clamp here and put another clamp above there. And then I'll be ready to start ligating, which means putting a little suture around the blood supply to stop it from bleeding when we remove the testicle. Okay, so now I'm just closing up the surgery site. What I'm doing is putting in a subcutaneous layer. So this just brings the tissues together, reduces tension on the skin when I close that up, and also reduces some of the dead space in the wound, just space where the tissues have been opened up basically, and it reduces fluid collection. So it'll just help it heal better and close nicely. And after this, I'll do intradermal sutures in the skin. So that will stop it from having any sutures needing to be removed later on. It just dissolves over time and should come together quite nicely. So now I'm starting the intradermals, which is the skin layer. So it's important for me to get the needle coming out through the dermis. But it's a very thin layer, so it can be kind of fiddly. Alright, so we've finished with Tank's surgery. He's just recovering now. He's still intubated because he's not quite ready to have that come out. We're letting him breathe off the anaesthetic gas and he'll wake up slowly over the next few minutes. So he's recovering with the bear hugger on him, which is a nice hot air blanket basically, and it helps him keep warm throughout the procedure. So now that he's been castrated, it'll take about 10 days for the incision site to heal up. We're going to send him home with pain relief, and we're going to get the owners to monitor him, make sure he's not licking. It's really, really important to make sure they don't lick, just because you can end up with surgical site infections, which can be quite nasty. So if there's any signs of licking, we want to put an e-collar on, which is like a little cone of shame to stop them from licking themselves. We also want to keep the wound dry and clean and keep an eye on it every day. So if there's any changes like redness, swelling, a discharge, call us straight away and we'll have a look at it and see if it needs any attendance. So now that he's been castrated, he might become a little bit more calm. Some dogs do end up with behavioural changes in that they become a lot calmer, less crazy, but some dogs don't really change that much at all. It depends what age you do it. It also depends what behaviours have been learnt and what behaviours are yet to be learnt. So if he's already developed the behaviour of peeing on things, then that might not stop, but if that was going to come later, then that might never develop, which is great. There isn't going to be really much change to his life or anything afterwards, just in terms of how he experiences life, but he's going to have a much lower risk of diseases like prostatic hyperplasia, which can cause a lot of problems when they're older, and he now has his testicles removed, so he won't get testicular cancer. Yeah, so those are the main benefits. He's also not going to contribute to the overpopulation problem. So shelters are full of puppies that just don't have homes. So this is, what we definitely recommend. All right, so the surgery took about 20 minutes. It'll take him an hour or two to recover. Some dogs take a little bit longer. Some dogs wake up really fast. So we'll monitor him, make sure he's waking up nice and calmly. He's, non-painful. And then when he's ready and awake and able to go home, we'll call his owners and organise a discharge time. So that's it for Tank's journey today. We'll keep monitoring him and he'll go home very soon. All right, so that wraps up Tank's castration and desexing. That followed us through the whole process from start to finish, from morning to afternoon. He's now gone home to recover with his family. If you'd like any more information about what you've seen in this video, please fill out the form below.